Kids there with you?
They're playing with kinetic sand.
Oh, okay. Tell them Nana said hi.
Okay, I will. I'll let them jump on here in a minute.
Okay.
Okay, Stephanie, I think we're ready to go.
Okay.
We're live on YouTube, just for everyone's awareness. This is being recorded, so people who aren't able to attend tonight are going to be able to watch it later.
Perfect. Sounds good. Thank you. Well, thank you everyone for joining us on a Friday night. I'm sure there's better things you might have to do, but hopefully the information we're going to provide to you today just helps with answering some questions, and then also mostly providing time to have questions asked of us so that we can get those answered. So real quick, we're just going to do some introductions so everybody kind of knows who's on the phone. Not obviously everybody, but who's going to be presenting. We'll go through really what this risk in school setting looks like, what happens when there's a positive case, and then testing components, and then questions after that. So I'll start off again. My name is Stephanie Michael. I'm with the Pacific County Public Health Department. Mostly been COVID response since the beginning of the year, since when I really started this job. But it's been a fun time. And then we have also, I'll turn over to Katie. You can introduce yourself.
Yes, thanks, Stephanie. I'm Katie Lindstrom. I'm the director at the health department. And we also have Lori on the phone, who I think might be popping in with.
I'm Maury Ashley. I'm the public health nurse that's been doing a lot of the COVID investigations.
All right. And Kathy, we didn't prepare you for this, but I imagine you might help out with question and answer if relevant.
Hi, everybody. I'm Kathy Spoor. I'm now the county administrator. I previously was the director of public health. So when all this broke loose, I kind of put my public health hat back on and have been involved with the COVID response since early March. I guess it's been several months. So
Thanks,
happy to
Kathy.
join us tonight.
And it looks like we have Nancy Morris and Steve Holland both on also, superintendents. So we may refer some questions over to you guys depending on if it's something we can't answer.
Great. All right, well, we'll get started so everybody can move along in their evening. The first thing is, if you are attending, please put yourself into a mute mode unless you're going to be answering or asking a question. A lot of times there's some feedback and we don't want to have people not be able to hear. And you can also type in questions into the chat box. So that's another place too. All right, so let's get started. First, I think just kind of setting the scene with what has really been assessed as a low risk environment, and that is the in-person instructional setting. When these safety practices are in place and when they're being followed. That relates to the daily screening that's happening as students and staff come into school, face masks that are being worn, it's the social distancing, which is at 6 feet or more, and that's being maintained, hand washing throughout the day, as well as just increased sanitation on high touch surfaces and the cleanings that happen too. So this came really out of all of those entities: OSPI, Department of Health, Labor and Industries, the local school district superintendents, and school labor representatives. So again, when we look at risk in the school environment, we assess it as a low risk, but there's still risk, right? And that's why we follow all these precautions that we need to. We do that particularly when we look at the spread of COVID. COVID is really spread from personal contact, from person to person. That is the main way someone is going to get COVID. So when we put those precautions into place, everyone's wearing their mask and everybody's keeping their distance, that ability for that disease to spread goes way down. And again, we're able to kind of go about our functionings, keeping those two things really important and helping us do what we need to do throughout the day. And in this case, be in a school environment, in-person instruction. You can see down there, that's that very low, right? Basically, to get any lower, you just have to stay home. And we're learning how we live with this disease because it has been here for a while, and it will probably continue to be with us for a while. So the biggest thing, and I think this is what's going to be most helpful for everybody to kind of understand, is what happens when there is a positive case in school. So first off, public health, we're notified of a positive case. We have a lot of different mechanisms that might happen. We have a large state reporting system. We have relationships with the hospitals and other places where tests are being done that we get those positive cases really fast. We also have the ability up in Willapa Harbor Hospital for people to get what's called an antigen test, and that's a rapid test. Sorry, if you guys could please mute. Yeah, thank you. Rapid test that gets results back that same day. And so then we follow and we act on that. At that point, a case is considered what we say probable. It hasn't been confirmed, but we act on that like it's a positive case in public health. So that positive case, we get in touch with them and we tell them that they are now a positive case and need to isolate. And what does that mean? Is that they're at home for the next basically 10 days from when they had their test done, or if they have symptoms, we talk about when those symptoms started and their time starts then. So it's a 10-day from that point. That also facilitates our case investigation, which generally leads us to a point where like this case was in school and that's now triggered a new response and coordination effort with the school. So we look at the school, we let them know, we give them, hey, we have a positive case, and then we ask for who are the contacts, who are those potential contacts that this student has had interaction with throughout their day at school. That basically is where we start our investigations and our contact tracing. The school in itself is also putting out a notification letter to let you guys all be aware that there has been a positive case at the school. And then we are working what we say are those potential contacts. They are going to be, sorry.
It's the next slide.
Sorry, real quick. Positive case, okay, sorry. Those potential contacts that's where the interviewing kind of happens, and that's where we determine if someone really is a close contact. Are those the ones that need to go into quarantine? So not all potential contacts will become those close contacts that require quarantine. And that's what takes us that bit of time. I know information here in this county travels faster than sound practically, right? And so it does take us a little bit of time to work through those interviews and really understand who are going to be our close contacts that we're putting into a quarantine status and requesting they get tested. Once that happens, we continue to not only monitor the case, we monitor all of those close contacts as well for the duration of their period, which is 14 days, a close contact, right? So let's go into this a little bit more. This was kind of the overall timeline, but what is that potential contact? The potential contact could literally be that kid was on the bus, and guess what? Any of those people on the bus, the driver or the other students, could be a potential contact. We want to know who was on the bus. We want to know where they are in the classroom, who's with them in the classroom, and then potentially where their lunchroom might happen or where their playground might happen. And then anyone throughout that day that student came in contact with for longer than 15 minutes at a closer distance than 6 foot. That is also going to trigger that close contact status. And again, not all of these people that are being identified are going to become close contacts. We are just getting that initial who's everybody that could be in this group, and we got to break it down and interview and really figure out who are going to be those close contacts. So for a close contacts within a school, and particularly within an elementary school, it's been determined that the classroom itself where that student was a positive case or that staff member was a positive case will trigger all of those to become close contacts. That's because of the duration that those interactions are in the classroom. Again, when you're looking at 6 or 7 hours in the same space, even though masks are being worn and distance is going to be covered, we know that there's an increased risk there. And we want to make sure that we're capturing that and putting everyone in that space into a quarantine status. The next piece is really more case by case. Oh, sorry. Within middle and high school.
Stephanie?
Yeah.
Oh, I'm sorry. You were going to talk about middle and high school.
Yeah. Within middle and high school, this is going to look differently because the duration will most likely change. They're not cohorted as groups like an elementary school classroom. And so that's where it will become more of a case by case issue that we'll work through to determine who those close contacts are. So for an example, right, if someone's in their science class in middle school and then they move to another class, potentially their lab partner in that science class might be the distinguished close contact because were they close? What was the mask wearing? All of that piece of it. So that's kind of just as an example, but not necessarily the rest of the class that had really no interaction or contact or close contact with that person. Another area of the case by case where it takes us a little bit of time is on the bus itself, right? Like for the most part though, like again, working this one in particular, all the precautions that are being put in place, the distancing, the cohorting of same households in the bus sitting together, the ventilation with the windows down, those all allow us to say that there is really a reduced risk there in that environment, and those are not considered close contacts on the bus. So again, we work through those as a case by case. And again, someone who has been in close contact, meaning less than 6 feet for more than 15 minutes, will get grouped into what's called a close contact, and those will all go into that quarantine status for 14 days. This is a flow chart. I'm going to show you two of them. This is the student one. This is the staff one. They're exactly the same, except for how they're labeled and a little bit of nomenclature change. But it's really the same idea that when you, particularly parents at home, is really who this is really geared towards. And we're going to have this posted on our website if it hasn't been already, and I'll show you that at the end. We are really focused on not allowing symptomatic persons to come to school. You probably have done some sort of what we call the attestation or the daily screening check. A part of that is something that you can reference here to kind of see where you are on this. So I'm going to go through each kind of column and speak to it. So first off, obviously you're getting up at whatever time, 06, getting all the kids ready for school. You're looking at your kids, you're saying, great, no one has any symptoms. Everybody's looking great. No one in here has recently been diagnosed with COVID, and none of us have been identified as close contacts. Everyone, we're going to school, right? And that's again, green light, go ahead to go to school. Things start getting a little more complicated as other criteria begin to be tripped, whether it's symptomatic or whether you're potentially involved in cases. So right now, the next column would say, still no symptoms happening. Oops, sorry, one second. This came into my field. They tested negatives from getting a test done or has not been tested, but is considered a close contact. So what we just kind of talked through, like that classroom that we're putting all into a close contact, they will not go to school. Then they will not go to school for 14 days. They're in quarantine. So again, that's where that's close contact triggered everyone having to be in that quarantine status. The next one, no symptoms, but tested positive. We know that this disease doesn't always have everybody develop a symptom, but people can be carriers. And so it's important that if someone got tested and they ended up being positive, they will now be in an isolation status for 10 days. And there's a difference in timeline there, right? Quarantine is, we're just waiting to see if you do become a case. It's a 14-day window, whereas if you're already a case, you're actually already going to have a shorter isolation time, and that's 10 days. So you'll hear those 14 or 10 days being used, and they need to be used appropriately with what they are, close contacts or an actual positive case. The next column, the middle one here, is talking about, this is where symptoms start to show up. You wake up, your little kid has some sort of symptom happening, and those are listed over here on the right. They have a fever, maybe they have some nausea happening. The biggest thing that they need to be able to do is stay at home, obviously, right? Even without COVID, if we were just in a normal flu and cold season, you would stay home. You would not send sick kids to school. The other layer of this is now with COVID, we kind of need to know, is it COVID or is it just sickness? In this column, it's talking about it is COVID. They test positive. So they go and get a test, they test positive. They are going to be in that isolation for 10 days. Also, their fever has to have resolved for at least 24 hours, and their other symptoms have to have improved for them to go back into the school environment. And that's, again, with no close contact. Close contact will cause that to change potentially, right? So we're always aware of, have I had and been cold? I'm a close contact. And you will be told by public health, you are a close contact, you are in quarantine status. The next column here, same idea. There's symptoms that have happened. You did go and get tested, and guess what? You're negative. You don't have COVID, and you have not been in close contact or just with someone with COVID and been told you've been a close contact. You still obviously don't want to go to school. You want to feel better. So we're talking about here is you have to have 24 hours after your fever has resolved and the other symptoms have improved before going back into the school environment. And then the last column here is where we talk through the idea of their symptoms present. There was a negative test or they did not get tested, but they are still a close contact. And again, close contact already equals 14 days in quarantine. So that's really important when you're looking at how these break up. Again, I've looked at this chart a lot and I still have to go through each column. So with your first view of this, I'm sure it's not extremely clear. They will be posted up onto our website and I'll share that afterwards. And we can kind of, if you have more questions, I'll tell you the number you can call, but this really should be used as a guide, particularly at home when you're thinking about sending your student to school. Where do we fall in today? You know, kind of make it a game. Oh, look, we have no symptoms. We are not COVID and we are not a close contact. We're going to school, right? So again, use it as kind of a tool that can help you in these decision matrices that are a little bit complex for sure, to say the least. So again, that was the student and the staff one, exactly the same. It just has staff instead of student. The biggest part too with this, and it always comes up, is you have to answer our phone calls in public health, or if we leave a message, please call us back. Again, we can't inform you if you're a close contact unless we get a hold of you. And what I don't want happening, especially in the school environment, is that kids show up and they're like being told they can't be there because they're a close contact, and that's the first time they're being told about it. It should come from us at Public Health, and we're doing everything we can to get in touch. I've had a few already today with full mailboxes, so it's a little bit difficult to leave a message. So if you see a missed call from a public health number, which is usually like a 214 start and a 6013 or a 6012, that's probably us calling you. Please answer so that we can get that ball rolling and get you kind of understanding where you are in that process and where you might be in quarantine or as a potential positive case too, because we call those as well. With that,
jump in real quick, Stephanie. It's really important that people understand that if you are not called by public health, that's because you haven't been identified as a potential close contact. Once you do receive a call from public health, you're only a close contact if after your interview with public health determines that you are. So it's kind of those two steps there. If you haven't heard, you're not a close contact. Now, that said, it does take us a day or two sometimes to get in touch with everybody. And we did have a change in some of our definition of a close contact. It actually happened today to schools. So there are some people who should be getting calls. They probably got called today, or will probably be getting called maybe after this this meeting here, who if they had children who were in the classroom with the student who tested positive. That's true for one of our schools. At the other school, it's actually because of the setting and where they were at, those students are going to be considered close contacts. But just to let you guys know that if you don't hear anything, that means that your student is not a potential close contact.
I have a question.
Mm-hmm.
Can you hear me okay?
Yep.
Okay. I've been doing contact tracing with the Department of Health since August for the National Guard. And I understand how contact tracing works. It can take a couple of days for us to be able to get the assessments, to be able to do the to do the interviews. How soon are we informing parents of cases that come up, and what if they are asymptomatic?
Generally speaking, we are getting our contact tracing done, the initial round of interviews, within about 24 hours. Our public health nurses are very fast and efficient. I will say that with this, there will be additional people called today, which is about 48 hours after our notification. And that's because of a change in one of the qualifications for close contacts. It got additional criteria was added that made more people close contacts than what we initially thought. So, but typically it's about 24 hours. We get those calls out, and sometimes a lot faster than that.
Okay, thank you.
Mm-hmm.
I have a voicemail I haven't listened to yet.
I had a phone call from a 607 that only rang once.
I don't think they're,
everybody on mute if you're, yeah.
yeah.
All right. All right. So that one, when you do get called and you're told you're a close contact, we recommend testing. We really would like people to get tested. So there's opportunities to get tested, and depending on how many people we might be contacting, we might stand up a testing event to support it. And so we'll tell you the time and date that you just need to bring either your student or the staff member might need to come, or again, whatever that looks like like for that close contact. But this is where we are right now as far as testing in the North and the South County. And you can always give the EOC, our Emergency Operations Center, call center, a call, and they can direct you to the what is the word I'm looking for? The next available testing event that there is to have access to. So that I just wanted to include this as a reference point for people, and especially in the recording. So that's really, like I said, our big thing was just go through that overview and really open up most of this for questions. I did want to real quick, let's see if I can stop share real fast. Hold on. Take everybody to another really good source of information, especially if you just want to be online and looking at stuff, is our the website here. So you should be able to see this, and hopefully it allows. So here is our COVID website. A lot of good information on here, particularly if you are interested in data and things. We have 2 data dashboards. So this one's actually being updated. So sorry, you can't see that one right now, but our risk assessment dashboard, these are things that are being put out by DOH. And so they're maintained at the state level. We also have a school information tab right now that's showing what should be, hold on. Oh, yep. There it is. So there's our risk assessment. This is as updated as I believe, on the 7th. This gets updated every couple days, usually, at least on Mondays for sure. So you can kind of see when we're talking about where we are within that risk of low or moderate or high within the framework that was put out by DOH and OSPI. We're maintaining in this moderate. Again, this will change as we continue through the weekend, as things do. And then here are those charts again that you can access and be able to just pull or look at sometimes on your phone or whatever might be easiest. So I just want to show everybody where you can access that on our overall website, again, just under that school information tab. So I'll stop there.
And I did put the website in the chat. So it's pacificcountycovid19.com. That's how you get to that site there.
Mm-hmm.
All right, should we just go ahead and start going through the chat questions? And then if people are on the phone, they can go ahead. We'll take a break to do phone questions. But otherwise, go ahead and get your questions in the chat. I think that's the most efficient way. So it looks like, I think we already clarified the difference between 10 and 14 days. The 10 days is for people who are positive and in isolation. 14 days is for people who are close contacts and on quarantine. So people who haven't tested positive. The 14 days is the incubation period. So it's the last day that you were in contact with the person who was positive, and 14 days from there is your quarantine period.
Katie, the only piece maybe to clarify there, the 10 days is the minimum.
The minimum.
You've been identified as a case because you have to, your symptoms have to be improved and you have to be without a fever for 24 hours too. So the 10 days is a minimum. So we'll be checking symptoms too before people would be released to come back to school or back to work, whatever the situation might be.
Great. Thanks for that clarification. Yes. So it's 10 days or 24 hours after your symptoms improve and no fever, whichever is longer for the people who have a positive case. And again, the 14 is for people who are just close contacts, did not test positive, and that's for the quarantine timeframe. All right. I would really like to know how the 5th graders are affected. I'm not sure which school we're talking about here. Maybe Jade and Willow, if you could clarify which school and that would be a helpful thing. We'll move on to the next question until you can get that in there. How long does it take to receive a call? We already answered that. We do our best to do that within 24 hours. What about allergies with runny nose and maybe a cough? So the chart that Stephanie referenced, it actually shows some of those symptoms like the cough and, I'm sorry, the runny nose. It's really tiny. I can't read it, but it says that can't, so it's basically a cough or runny nose that can't be attributed to allergies.
Yeah.
So if you know that you typically have allergies and you know that your runny nose is from allergies, and that's something that is very typical for you, that wouldn't be considered a symptom. If it's something though that's out of the ordinary and it's something that's an illness related runny nose, then that would count as a symptom. The other thing that's important to note on this symptom list is the fever. So if you don't have a fever and it's because you took Advil or Tylenol, you're still considered to have a fever. It needs to be a medicine-free, no fever it can't be a fever that is, I mean, it can't be, you don't have a fever because you took a medicine. So hopefully that makes sense as well. All right. When a case at a workplace happens, do they call the company or each individual, such as a cannery? Stephanie, you want to take that?
Sure. So when a case is identified on where we get a case, we obviously start the case investigation and we start figuring out where they've been, where they work, all those pieces. We start working with that location to help us identify, just very much like the schools. We need to understand who are the close contacts that need to be put into a quarantine status and get tested. And so that's where we'll start. Again, if we get more cases out of that, 2 cases outside of a household is considered an outbreak. We start looking at potentially how we would test potentially that workplace itself, right? So it really does just depend on what happens out of that initial, what we call that initial catch of close contacts, although they are all put into a quarantine status from their job and from life in general, just have to sit at home for 14 days.
Thanks, Stephanie. Okay, the next question. If more cases come up in the school, at what point would you consider going back to distance learning instead of in person? So it's important to note the state has set forth guidelines for the health department to use. It's based on data, and it's for us to use to make recommendations to the school, whether they should do in-person schooling, hybrid, or fully online school. Initially, we had a recommendation for online learning, and that was based on our data, which over the course of August, which is that time period, it was bad. We were in the high risk category. And so we made a recommendation to start online only. Over the next month or so, the data actually improved pretty significantly down into the moderate and even into the low risk range. And that's why we then made the recommendation to the schools to do a hybrid, partially in person, partially online model, in which all of the schools move forward with. We're currently, I think, inching back up into the high risk category, and we may be there for a few days. The criteria we use, though, is that we need to see a sustained increase over the course of at least 3 weeks, a 3-week period, before we would make a recommendation to go backwards. It's the same way we waited for a 3-week period for the data to get better before we made a recommendation to loosen things up. So that's generally what we're looking at, is a sustained 3-week period in a different risk category before we start making different recommendations. Now, the only other way that school would be canceled is if we do have cases that, and it is determined that there is community spread at the school. That would be a situation where potentially the school could get closed down for a certain period of time to basically quarantine, if it could, because it's a lot of people who need to quarantine, or for additional cleaning or anything like that. So we're not at that point right now. We only have one case in each school, one probable case in each school. And so we're not at the point right now where we've have any evidence of community spread, meaning that students spread it from student to student or teacher to student in the school. But if that happens, it could be potential that we would look at shutting the school down for a week or 2 in that situation. Okay, perhaps sibling in 5th grade. Okay.
Katie, the 5th grade question I'm sure is about Willapa Valley.
Okay.
And so the 5th grade class is situated in the end hall, kind of near the district office. And we intentionally did that to separate them for the rest of the school. The classroom where our student is located is down the other hallway. And so they don't have contact with each other. Their schedules are different. So they don't, they're not in the same space with each other. They go into the commons to eat lunch, but at different times, and each desk in the commons where students eat is disinfected between groupings. And so that's why we allowed 5th and 6th graders to come back in for school, because it was disinfected each time between spacing being used.
Okay. Yes, and that's a really good point. So we're not looking at any of the students in either of the current cases as being quarantined unless they had either that direct, sustained 15-minute contact closer than 6 feet with the student who tested positive. That would be one scenario. And then at Raymond, because of the classroom size and the enclosed nature of the classroom, the classmates of the student at Raymond would be on the quarantine status. My understanding is the classmates of the student at Valley are not considered close contacts, and that's because they held their class in a large open area with plenty of distancing. And not that Raymond wasn't following the 6-foot distancing room, but an enclosed classroom is a lot smaller than a large commons area. So just to answer that specifically, other students at the school who were not in the same class as the students would not be considered close contacts unless for some reason they had a sustained greater than 15 minutes, closer than 6 foot encounter with that student on a day that the student was infectious.
Katie, a second question in the chat box that might be ours is about a student that was in the classroom for 3.5 hours. And I'm correct, but it is that large open classroom area, and each student had their own distinct area that was over 6 feet apart. And so that, I think, is the answer to that one.
Yes. And we can tell you that the classmates of the student at Willapa Valley, because of the circumstance and where they all were and how they were situated, those students are not considered close contacts. The classmates of the student at Raymond are considered close contacts. And again, it's because of the duration of time that they spent together in an enclosed classroom. The schools have done a very good job of enforcing mask wearing and distancing. And typically you're not a close contact if those things are happening. But because of the duration of time that you're in an enclosed classroom together, that's why those Raymond students are going to be quarantined. It's actually fairly low risk that, to those students, there's probably a fairly low risk because mask wearing and distancing were happening. But out of an abundance of caution, we're going to, those students are considered close contacts and will be quarantined. Okay. So let's go up to the next question here. A lot of stuff about fifth graders. Okay, hold on. I received a call from my school saying my student was in the classroom for 3.5 hours with another student who tested positive, but haven't heard from the health department. I would, Penny, go ahead and give us a call tomorrow. Oh, well, actually not tomorrow. I'm wondering if we can answer this call for you, maybe offline after the meeting. Maybe we can stay on, or you can give us a call.
I think that was what Nancy was just referring to.
Oh, okay. So that's good. So I'm confused. I received a call saying my child was in contact on the buses. I was told he can go to school if I allowed it. Isn't this incorrect? No, it's not. So your student was probably considered sort of a potential close contact because they were on the same bus. But upon further investigation, I'm guessing it was determined your student was not sitting closer than 6 feet to that other student, that they were all wearing masks. And so your student wouldn't have been considered a close contact on the bus. Now, an example where a student on the bus would be considered a close contact is if they were seatmates and they were on the bus together for 20 minutes. That would be a close contact on the bus. But if your student is at the front of the bus and the student who's infected is in the middle of the bus and it's further than 6 feet and it's only a 10 or 15 minute drive home, then it would not be considered a close contact. So it's really a kind of a case by case basis. That's why we get that pool of potential close contacts. And then the contact tracing nurse kind of does the investigation piece, and she sort of whittles that potential pool of close contacts down to actual close contacts.
Katie, if I can add one more detail, is the first one off of the bus at the end of the day and the last one on the bus in the morning. And so he only rides for 7 to 8 minutes. And so,
that's great. Yeah,
that really helps.
Yep. All right, let's see here. Wanted to provide additional clarification. I wanted to provide additional clarification when isolation period ends, and that is 10 days after symptoms first appeared and 24 hours without fever. Thank you. I think Kathy provided that also. Okay, are there any other questions? Would anybody who is not on a computer and who'd like to just verbally ask their question and take a chance to take those now?
For students who are considered immunosuppressive or may have issues with getting sick a lot, are we able to take them out of school to have them do distance learning instead of going into their group A or group B?
I'm going to let Nancy and Dr. Holland jump in on that.
At Willapa Valley, absolutely. All a parent would have to do is call their school's office and let us know, and the principal will. Go ahead, Steve.
It's the same thing in Raymond.
Okay, do we have any other questions from people on the phone or even on the computer if you'd like to ask them out loud? Okay, I'm not hearing any more questions. Dr. Holland or Nancy, would you guys like to add anything specific? Any other information from your schools?
We did decide to delay our start for our middle and high school 1 week. We have several staff members who are quarantining. Decided to take a little bit of extra time, be cautious, and walk through our protocols. And so we're going to start on the 19th with grades 7 through 12. But that being said, anything else in place is happening the same for K through 6 or any of the special groups of kids that have been coming in. That will continue, as will our food service.
Okay, Dr. Holland,
Good.
anything you'd like to add?
Yeah, I'll just say that we're continuing school next week. We won't have that one class because they are quarantined. And we also will be starting on the 19th with our grades 7 through 12.
All right, great. I guess, Stephanie, do you want to push us back to that last slide with our contact info?
Sorry.
Just want to kind of reiterate here, you are welcome to call us anytime if you have questions at the EOC. That's the best way to get a hold of us, which is 875-9407, Monday through Friday, 8 to 4. And then also our PacificCountyCovid19.com website is a really great resource if you're looking for other more general information or data. And yeah, if you have any questions at all, please reach out. And we appreciate you guys taking the time to be on the forum tonight. And I think anybody else have any last words? Stephanie, anyone else?
The
Nope, we're
only
good.
thing that I would just put out there in general is for, particularly as we, coming into Halloween and Thanksgiving and the holiday times, to keep your circles small, which is difficult, especially during the holidays. But much of the spread that we've seen throughout the pandemic here in our county has been related to family gatherings. And so it's real important for folks, if you are getting together, keep your circle small, maintain your distance. If there's any high risk folks in your group, really be thoughtful about that, because again, as we come into the fall, we won't be surprised to see an uptick in the number of cases just because more people are in closer contact with one another, which increases the chance for spread. So just a reminder to everyone to be careful and be thoughtful about the number of people that you spend time with during this time. Hopefully this is not going to be forever, but for right now, it's really the most prudent thing for us to do.
Thanks, Kathy. That's an important message. And I think the other thing is with the contact tracing, and when these sorts of things happen, it really becomes evident on how important it is to keep your circle small and to be wearing your masks and doing the distancing. I can tell you, we felt much more reassured knowing that that was happening at the schools. If it was not happening at the schools, this would be or could potentially be much worse. And so we're really grateful that the schools are good partners. They're reinforcing those healthy habits, and also to the parents at home and your participation in that.
Your kids are doing great.
Yes,
Yeah.
Good
Yay
job
for the kids.
All right.
I just want to say thank you to you guys. Really, we couldn't do it without you.
Thanks, Nicole. I think it takes all of us, right?
Yeah.
All right. Okay, well, I think we'll go ahead and wrap up for tonight. Again, thanks for being on this. We will send you, Dr. Holland and Nancy will send you the YouTube link with this recording in case other parents want to watch it after the fact. And everyone else have a great night.
Thanks. Have a good weekend.
All
Bye-bye.
right, bye.
Thank you, guys.